and we provide free medical care to all Latinos here. And I take it and provide full care, open heart surgery, pacemakers, not a dime to them. Yeah. We have a provision where the doctors provide free cardiac care to all Latinos in Frederick County. So there's a mechanism. Plus, when they do come to the emergency room, they don't pay their bills. They don't arrest these people. They get free medical care, even for electives. They birth their babies here, their angioplasties, gallbladders, everything is done for them. So this is the great thing about American medicine. And then the other group is basically people that are not in the poverty level, earning $50,000 to $70,000 a year, choose not to get health insurance. The typical thing is a truck driver from North Carolina goes through Frederick, has his heart attack. He chose not to get health insurance to save money for something else. Yeah. I don't know what he's going to use it for, but that's not right either. Then at the end is 8.5 million people who can't afford it because the price is too high, and that's where reform has to come. So basically, how do we help these 8.5 million people get insurance who are chronically unemployed? And that's where we need to focus our conversation on this and what's the options. And we're going to go over what some of the options are from the different committees.
All right, we're going to take a quick break. If you're just talking about health care with Dr. Vitarello, who's chief cardiologist at Frederick Memorial Hospital. Doctor, what's bad about it? I mean, we've come to the agreement that we have the best health care system there is to offer in the world. What needs to be reformed, and what are the things that are bad about our system that they should be focusing on?
What I'm focused on is trying to get these 8.5 million people insured and offering them affordable insurance. And that's where the government, I'll go at the end of the show how they can do that. So you need to lower the cost. Like, for instance, one of the major carriers in insurance made $680 million last quarter. That money came out of your pockets and your health care. That's too much money. The federal government has to work with these people, and I'll show you how the options work later to reduce that cost, to have a big pool so the federal government can use private insurance companies and use a big pool, their buying power for all these people, and lower the costs. So basically, the uninsured need that. How do college students get involved in this? You don't have to give them the premium health insurance. What you want is catastrophic. They break their leg in tennis, car accident, God forbid. You want them treated for that. They're not going to be going to check their cholesterol levels at age 18. You don't need that like you and I do. So lower the cost for them. And the other thing is you have to mandate that everyone get insurance in this country, because for every person uninsured, at the end, we're paying $1,000 per policy for these people who are uninsured. So when they go to the ERs, they rack up these big bills. We pay for it, and it's not fair. So you have to take personal responsibility, Blaine, in your life. That's so important. Then the other thing is tort reform, and this kind of blows my mind here. Here's Obama coming in saying, at the end of life, we're doing all these unnecessary medical tests for old people and for other people that doctors do it to cover their asses so they don't get sued. Well, that's true. Doctors do order excessive tests not to get sued, number one. Do they get sued? You better believe it. About 2% of all malpractice cases are found against physicians. Only 2%. Not high, but it exists.
Sure.
And I personally believe if they took your wrong leg off or they hurt your child, you deserve compensation. But here's the boost that we need here. There's no tort reform here. None. It costs our country $30 billion a year in legal fees. That's 1.5% of the total budget of our healthcare system.
$30 billion.
And that doesn't account all the tests that we do. And that's probably another $100 billion. You can literally pay for that. Now, why did that happen? Blaine, what do you think? I'll tell you what happened. Last year, Obama got $238 million from the trial.
Political contributions.
$238 million. And he gave also, guess what? The doctors gave gave about $80 million, but they outgun us when it comes to that. So what happened is the Republicans got $90 million from the trial lawyers. So you're up there. So why do we do this? Well, this system is so archaic. It reminds you of Wall Street, doesn't it? The greed, absolutely. It's the same stuff that brought down the stock market. It's the same brought down the banks. It's the same Fannie Mae stuff. This is the last of the greed guys. Why should a lawyer get 30% contingency fee of if you lost your leg for $1 million? Why should he get $300,000? What you really need to do is you need to revise the system, have an arbitration board run by the government and counties, and you go there, the doctors and lawyers are paid per hour to review the cases, and then if you lost $1 million leg, give that $1 million to that poor patient, please. Give it to the patient that needs it, and you will stop this increasing cost of defensive medicine. Obama is now basically in the pockets right now, unfortunately, of the trial lawyers. And he can't say it. There's a lot of pressure.
That's not being addressed at all.
Zero. And it's zero. And that's why you need to call.
It's probably the number one area that needs to be reformed.
And Senator Cardin of our state Finally say, guess what? I'm not going to sign a bill unless I see some malpractice reform. Then the other thing is basically the cost of medications. One thing is the VA system really does, the Veterans Administration Hospital, they have a formula of generic drugs. That keeps medicines down. We should use generics. Now, that famous line, the red pill versus the yellow pill by Obama, that was another faux pas. Sometimes the red pill is better than the yellow pill, and doctors use the better pill. Let me give you an example, cholesterol. If you use Lipitor Crestor, it's known to reduce heart attack by 54%. The old-fashioned drug, pravastatin, doesn't do the same thing and reduce death and stroke. So why would I want to give you a cheaper medication if you're going to die quicker? Well, obviously I'm going to give you the better pill. But there are many pills out there that are generic that work just as well as the non-generic. So the pharmaceutical companies make too much money here in this country. Why would you want to buy a Lipitor for $3 here in this country and get it for $1.10 in Canada? So the American people are getting ruined here. That's wrong. So the pharmaceutical companies have now pledged a reduction over the decade of $80 billion. Okay? The Hospital Association, the Maryland all hospitals in the United States have pledged $180 billion reduction. So let's talk about the next thing is insurance companies. They charge too much. And that's another thing. Fourth, there's fraud. There are bad doctors out there and individuals that say they're doctors that bill Medicare, and they need to bring that group up to look at these people. Like the SEC did not do it, Maddox. Wrong.
Yep.
Okay, and they need to look at fraud and make sure that doesn't happen. And then we need preventive medicine. We need to work with the American public to make them healthier, give them preventive medicine, and then pay these primary care doctors better so they can teach preventive medicine to reduce heart disease and stroke.
But this bill doesn't address any of this.
No, it doesn't do anything with tort reform, number one.
Yep.
What it's trying to do is push people into this
But what about
public
the
auction.
pharmaceutical companies? What about the
Nothing.
insurance companies?
No, they didn't do it. Let me tell you what happened with Bush. Bush basically with the
And
Medicare.
that's where the greed is, though.
Absolutely. Bush didn't do it right. He said he got these, quote, formulary plan for seniors with a donut. He should have went to, listen, I'm the federal government. I got like 47 million policies I can offer you. Instead of $3 a pill for Lipitor, you're going to charge me 80 cents. And I want to sell it to the American public for 95 cents. And that's what just to cover costs. No one has the guts to talk to the pharmaceutical company and say, yes, lower that. Now, what happened about doctors? We, too, have taken a 34% reduction over the last decade in our fees, and now they want to charge a reduction of 40%. What does that do, Blaine? That means half the doctors in the United States don't take Medicare. Yeah. So I want to ask you a question. If you offered a public option like Medicare and half the doctors don't accept it, that's like you offering a ticket to Canada tonight on TWA. They don't exist anymore.
That's right.
You're going to walk. So they're not connecting the mothership. They're kind of this, you know. There you go.
Hey, let's take a quick phone call before we got to take the 3:30 break. Grab your earphones there. Talking about the healthcare. Talking with Dr. Vitarello, who is the chief cardiologist at Frederick Memorial Hospital. Doug, welcome to the program.
Hi, Blaine.
How you doing?
Fine. Dr. Vitarello had started off the discussion with the differences between the U.S. healthcare system and what you have, say, like in the U.K. And I'd just like to know, as an example, what would be the differences in the outcome in heart disease in, say, the U.K. versus what we have in the U.S.?
All right. Doug, we're going to take a break, come back, because that's not something you can answer in 30 seconds.
Okay.
And we want to get into that whole section there. So, Doug, very good question. We're going to get to your question and outline much more than that in terms of what type of care you would get under the British system. So thank you for your call.
All right.
All right, we'll answer you. We're going to take a quick break, talking healthcare with Dr. Vitarello. I want to thank Putman Plumbing and Heating, Marlene and Patrick in Middletown, Buckingham's Choice, Premier Retirement Facility. The next open house is August 20th, which is